Okay, my talk today is on Ramadan education and telemonitoring in primary care. First of all, thanks to the Alliance for inviting me to give the talk, and thanks to all the participants for attending this talk. So I'm going to cover on the study which we presented at ATTD last year on the effectiveness of diabetes education and medication adjustment with telemonitoring intervention in reducing diabetes complications during Ramadan fasting, a randomized controlled trial. Here are my co-authors from Singapore General Hospital, Singapore General Hospital, as well as the Singapore Health Polyclinics, the primary care. So here are the background and aims. We understand that telemedicine enables an intensive, large-scale monitoring and intervention during fasting, given the altered diet and activity. Hence, we proceed to examine the following. Examining the effectiveness of pre-Ramadan education, medication adjustment, and telemonitoring during fasting, and how these help to reduce acute complications when compared to standard care in our primary care setting. So the methodology for our study is as such. For Muslims with diabetes planning to fast, who are recruited from the primary care, we randomize them into intervention and control. For the interventional group, they undergo pre-Ramadan education, blood-based glucose, self-monitoring, and telemonitoring before Ramadan, all the way till the end of Ramadan. For the control, they undergo standard care, which is available at our public primary care sector, with regular visits, education or medication adjustment as needed, without pre-Ramadan education or telemonitoring specifically given. So the primary outcome for this study is the fixed incidence of hypoglycemia in Ramadan between the arms, and the secondary outcome is incidence of hypoglycemia and hypoglycemia in Ramadan compared to before and after acute infections and healthcare utilization. Surveys were administered before and after Ramadan, and medical records were reviewed. Continuous data presented as means, while categorical data presented as frequencies. 2 sample t-tests were performed for continuous outcome and chi-square tests for categorical outcomes. P-value less than 0.05 is significant. So I'm going to present the results. This data is not published yet, so I hope that there's no photo taking. So for table 1, this is the baseline characteristics of our participants. The number of participants were 79 for the study, for mean age of 59 years. 62% were females, and 100% had type 2 diabetes, with duration of diabetes more than 10 years at 45% of the population. For the diabetes treatment, 30% of this group have insulin therapy, and the mean fasting duration for the whole group is 30 days. So when compared between the primary and secondary outcomes between intervention and control arms is as such in table 2 on the right. Shows first incidence of hypoglycemia in Ramadan at 29% for intervention and control at 10%, which is statistically significant. And the incidence of hyperglycemia is at 8% for intervention, with hyperglycemia for control at 2%, which is also statistically significant. So this shows an increased rate of first incident hypoglycemia and hyperglycemia for intervention arm with no acute infections or unscheduled visits. During hypoglycemia, 40% stopped fasting in the intervention arm, double that of standard care, and this is statistically significant. Overall nutrition consumption decreased with decreased weight, and total MET minutes per week increased for the intervention arm, but decreased in standard care, meaning there is a higher level, increased level of physical intensity, physical activity. So if you look at the figure 1, it shows that when you compare the pre-Ramadan physical activity versus the post-Ramadan physical activity, on the right, So on the left compared to the right, you can see that there is actually a larger number that have high level of physical activity in the post-Ramadan, both for group 1 and 2, but especially for group 1, which is the intervention group, and compared to before Ramadan. So the conclusion is that for pre-Ramadan education, medication adjustment with telemonitoring, there is increased detection of hypoglycemia and hyperglycemia during fasting, and with appropriate hypoglycemia management with increased energy expenditure. So this study proves to highlight the importance in detecting acute diabetes complications in primary care, and the program also shows that there is great benefits in having patients undergo such a program before Ramadan to manage them better during Ramadan with better outcomes. So this another acknowledgements for this study. The study is actually funded by this research grant, and statistical support is stated, and the recruitment is done at the primary care polyclinics. So that's all. Thank you.